Welcome to Meditech training. In this tutorial, we will be reviewing the general structure of the Meditech ED system and the basic physician documentation components.
When you log into Meditech, you will be launched to the application menu. You will select edm.cht. This will open the ED tracker for all sites. There will be several patient trackers available for use for each location. The overall tracker will look similar to what we currently use with strictly a patient lookup and location list. This will also have limited indicators available to access the clinical record. The patient tracker that will be used as the workhorse for all trackers will be a double-line tracker like you see in this screen, with additional indicators available for use. The patient status of arrived will still be indicated by the 5 stars positioned across the status line. We still use this currently to indicate patients waiting to be seen. Several other new trackers that you'll be able to access will be length of stay trackers, ordering the patient by their visit duration, as well as a My List tracker, which holds all patients associated to the current user within the last 7 days. Searching for patients will be done using the patient routines in the Magic Key menu, if the patient's visit was beyond 7 days. You'll see that the indicators on the tracker have also been modified. The diagnostic indicators have been separated so that more specific results, such as strict urine indicators, will flag when urine tests are ordered and resulted. Urine studies are separated out with the general lab indicator to avoid the risk of a lab result staying red when a specimen has yet to be collected. So the urine test will be red when it's ordered and green when it's resulted, and will not be obstructed by other tests that are still outstanding within the lab category. There are new indicators that will appear on the tracker for reference. Based on certain components of the triage assessment, the sepsis indicator will populate automatically at different levels of risk. The patient will be classified as possible sepsis, severe sepsis, or no definite risk. You may also see an indicator that flags INFX. This is followed by additional letters indicating the specific type of infectious disease history had by the patient. You will see an MR for MRSA, CD for C. diff, or a V for VRE, in addition to several other infectious disease criteria. Readmission alert signifies the number of times that a patient has come through the emergency department or the Winstead ED in the last 30 days. You can click on this indicator to link directly to clinical review. This gives you a summary of visits and all recent ED visits, in addition to a lifetime summary of all patient encounters, which may include office visits or outpatient studies as well.
You are also going to notice a change to the ordering of the buttons available on the right-hand side of your screen. PCI and orders will function in the same fashion that they do now. There will be a new button called Review. This button opens the clinical view routine, which is another way to access historical data on the patient. This is also a platform used to bring specific data points into your note through a copy and paste method. The Document button is self-explanatory. It opens the documentation routine that provides access to all available complaint-specific templates. The Sign Up button applies your initials to the patient. It's important to use this function as an attending because it also timestamps your note for time seen. The Reconcile button opens the MedRec routine to review home medication, pharmacy preferences, and medication refill data through the Doctor First database. The Tracker button functions in the same fashion with a list of available trackers that will resort your data. The Sign button opens your sign queue so that you can sign notes requiring cosign, access drafts of notes that are requiring completion, or cosign orders as you currently do. The Depart routine is used to print the discharge packet and manage prescriptions. The Summary button opens a view of the ED summary that holds nursing documentation, orders, medications, allergies, and all other data related to the patient visit. Snapshot is a demographic view, and the Go To button is a search feature that allows you to search active patients that are currently in the ED. In this screen, you will see a representation of the clinical review routine. As I referenced before, this is a one-stop shop for patient data for the current visit and also gives you access to their lifetime summary in relation to their Meditech records. Content is arranged by category and time, and the buttons on the screen that are highlighted with a black font indicate available data in that category. The blue font indicates that there is new data since you last opened this area of the patient record. Any low-lit gray font on any button is an indicator that there is no data available in that category. Notes and reports are housed in PCI as well as the clinical review routine. To access these in the clinical review routine, all historical notes that have been completed are filed under Notes History or Other Reports. For emergency department notes, these can be accessed by opening the Other Reports button in the right-hand column. All nursing assessments, including the triage intake reports, can be viewed in the Assessments button. To view a complete report or assessment, click the date of the report, which is housed in the left-hand column. This will open a screen to view the entire content of that particular assessment or note. After reviewing the data in this routine, you can return to the main tracker using the Patient List button. Now we will move on to documentation. Highlight the patient and click the Document button. If you've not already signed up for the patient, you will be prompted to do so. Sign up will timestamp your document with the time seen for providers. Walk-in visits will file in a separate location from Charlotte Hungerford ED visits and Winsted ED visits. To accomplish this, you will select different template types from the list. ED and Winsted will use the template starting with ED:, and walk-in providers will select templates with the prefix WLK. Content is very similar throughout these templates. Templates that are most commonly used can be saved as favorites, similar to the way we save favorite orders in the Orders module. All templates, regardless of the chief complaint, have a similar structure to mimic a paper chart. Tabs will represent each piece of the note. The notes begin with the HPI and proceed through the review of systems, past medical history, exam, and diagnostics. Other sections may be added to the template depending on the chief complaint requirements. Every template will end with a departure tab that manages the patient's disposition and accesses the electronic prescription routine for all providers. We will be prescribing non-controlled substances electronically, and for the moment, controlled substances will be printed and signed and handed to the patient at discharge. Each template has been built so that it has options for point-and-click discrete fields as well as narrative free text areas. The narrative free text areas could be used with the Dragon dictation system and also can be used in conjunction with point-and-click items to enhance documentation. The point-and-click options may be groupings of options to select or lists of positive or negative findings. These documentation types, again, can be used together. For example, you may select the data from the discrete field and add an additional narrative about the visit. Anything that has a narrative field can be accessed with the keyboard or Dragon voice recognition to add detail to your note. Data that is collected by nursing can be pulled into the provider templates and modified as needed. In this screenshot, you see smoking status and social history pulling directly from nursing documentation that was completed at triage. Allergies and reconciled meds also pull from the allergy and medrec routines that are completed during the intake process. Past medical history will carry forward from previous visits and previous admissions into the hospital. It is entered through using the IMO tool that is currently in use for admission diagnosis and problem list management. When medical surgical history is added using the problem list, it grows over time. The IMO tool is a type-ahead lookup to add medical and surgical history. This data will pull forward from previous visits, and you can select which items are visible in your ED note. Family history data can be entered in narrative form using additional comments or by using the checkoff fields associated with common medical conditions. Those common conditions can be associated to specific family members, represented by the initials M for mother, F for father, S for sibling, GP for grandparent, and C for child, respectively. This data will carry forward to the next visit. Additional social history data points can be entered in the History tab. A review of the allergies and home medications is available in this area of the template, and it will appear in the visit note. Allergies and home medications pre-populate from triage and are also pulled forward from historical data within the record. Triage vital signs will automatically populate into the note. Exam notes can be entered in free text fields, or utilizing a Save Dragon macro, or by using the point-and-click method. As a time saver, on most systems you will see a normal button available for use on the same line as the Next or OK Next buttons. The normal button will populate predetermined answers of the normal exam for a particular system. These can be changed by checking or unchecking the appropriate fields on the template that have been populated by the normal button. Diagnostic test results and interpretations can be pulled into the note or dictated directly. Meditech will not pull the results into the note automatically when they are resulted, but there are several ways to add the labs to the note. Some users may elect to pull all available labs into their note using a tool called Data Formats. Data Formats inserts a pre-selected panel into the note in the lab section. Others may select labs individually from the clinical review application. The most common studies have been added to the Lab RAD tab. Discrete fields and or narrative fields are associated to each study type. Many of the elements have fields for timing, for those studies that are time sensitive, such as EKGs or bedside testing. Radiology studies also have a timestamp, but this area is used to indicate the timing of the interpretation of the read by the ED provider. Similar to the structure in the current EMR, the Course tab has data related to the coordination of care, reassessment progress note areas, medical decision-making data fields, and also the hand-app documentation for those patients that remain in the department after change of shift. Similar to the function of the Lab RAD tab, each element on this tab can be repeated to add reassessments or document multiple elements of the same type. For example, if you consulted 2 services, you would document the data regarding consult number 1 and then select the repeat button to generate a new consult for consult 2, all having the same data fields, but will be indicated that it's coordination of care step 1, coordination of care step 2, or consult obtained number 1, consult obtained number 2 in your final documentation.
Medical decision-making prompts are available to accommodate the general data points in an MDM note. Final diagnosis will be documented in the last section of this note, which will be covered later. If the patient visit requires additional specific documentation that is not available in the general template format, you may add more detailed documentation through selecting an additional section. Additional sections may include procedural documentation, specific scoring tools, or expanded systems exams. Click the Add Section button in the right column and select the section from the list. The new section will appear in the note after the tab that was highlighted. In this screenshot, the Course tab was active when I selected Add Section. It pulled in the Procedure section, and that is positioned to the right of the Course tab. It cannot be moved left or right once it has been inserted. It can be removed by highlighting the added section and then hitting the Remove Section button. This would be used if it was added in error or it needs to be repositioned within the note content. Once you remove the section, any content that has been applied to the note will no longer exist. So exercise caution in removing tabs, especially if documentation has been added to that section. The Depart section holds all elements of a patient disposition. Clinical impressions are your final diagnosis and any ruled out differential diagnosis, the disposition of home, transfer, admit, as well as their condition upon discharge. Specific documentation elements related to their disposition are also available on this tab. The final diagnosis is managed with the clinical impression routine. The diagnosis will be selected using the IMO tool in the same fashion as when problem lists are updated and admission orders are written. You may also be prompted to add qualifiers to the diagnosis to improve specificity. In this routine, you can also add differential diagnoses that were ruled out during the visit. After completing the disposition and condition, also in this tab, you will move to the applicable type of disposition. The fields in this screen clarify the final disposition of the patient and their condition at the time of discharge. After completing these fields, which are required, You will move on to document the details of the disposition. Select the corresponding disposition type and expand the template with the plus sign to access the discrete fields.
The discharge section holds all of the elements that would be essential for a safe patient discharge. Patient instructions are selected from a hospital database. This is complaint and diagnosis specific, as well as being written at an age-appropriate level for understanding. The additional instructions area holds canned text similar to what is distributed to the patients today at the time of discharge. This can be modified using your free text option of typing into this field or using Dragon voice recognition. A few standard departure forms, such as return to work or school excuses, can be filled out and printed with the discharge packet. Prescriptions are also managed within this routine, and they are prescribed electronically for non-controlled medications. Currently, controlled medications are printed and signed. In the future, this will transition to a 100% transmission of all prescriptions electronically. The Copies To function at the bottom of this screen is a function utilized if you wish to have a copy of your documentation sent to a community provider. This will be sent to the provider after all authors of the note have signed and locked their documentation.
Several common forms have been created within the system, and these can be completed and printed out for the patient at discharge. These forms will print with patient demographics and hospital headers on the top of each sheet. Signature lines are also available on each form if a signature is necessary for that particular document. All prescriptions will be entered and transmitted electronically for non-controlled medications. This will be covered in more detail in a separate tutorial. But just keep in mind that eventually all drugs will be sent electronically depending on state regulation changes. Referrals for follow-up can be entered for any service or discipline, as well as external groups, such as Community Health Center. Referrals are entered automatically for a primary provider if one has been given at triage. This data is entered in by registration and will follow the patient through their visit. Additional referrals would be selected from a pick list which is searchable. To print the discharge instructions and associated forms, highlight the patient from the main tracker. Select the Depart button in the right column. This will open the Depart routine and allow you to print the packet, which contains the discharge instructions and all associated forms to give to the patient. This is accessed using the button titled Print Packet on the right-hand column of your screen. In the admission documentation, the decision to admit data is now collected in the documentation itself. There will no longer be a need to enter a separate order related to decision to admit. The additional data about the admission is captured using the discrete fields in the drop-down. The template offers an option to recap why the decision was made, what attending accepted the patient, and to where the patient is tentatively being admitted. A new documentation component area exists that captures items that may be present on admission, such as wounds, UTIs related to catheter placement, and surgical site infections. This assists in determining pre-existing condition and events that occurred prior to floor placement. Transfer documentation elements will be captured in the transfer fields. Specifically, we will capture the reasons for transfer and the discussions point had with the patient if applicable. You will also be able to document the accepting attending and facility with specific level of care requirements for the transfer. As with other areas of the record, some data is captured in a discrete point-and-click field, and a free text narrative is also available for additional details. In the area for documenting expired patient information, we will capture the date and time of death in discrete fields. All the other documentation is left for free text. The PA supervision fields are designed to allow the supervising physician to detail their level of involvement with the case and sign off on the disposition plan. There is also a free text area to add additional data related to the case. The critical care time fields are used when necessary to document specific time for critically ill patients. The critical management and pertinent exam elements, as well as procedures that are included and excluded based on billing structure, are clarified in this section of the template.
We will now review the final process for completion of a document. Documents can be signed and locked or saved as a draft. If you are handing the patient off to another provider, the document should be saved as a draft. The following provider will complete all the necessary fields for the final disposition of this patient. After that provider has completed their portions of the note will return to your sign queue for final review and sign-off. Until you sign off the document, you still have the ability to add documentation or modify your templates. You may also use the Save as a Draft function when you have partially completed the documentation for the visit. If you plan on returning to complete the note, you would save it as a draft and then return to add additional documentation. The Quick Save button automatically saves your note as a draft and is a shortcut to do so. If you select Submit, the preview of the note will open for your review. You can read your note from this screen, but you cannot edit the documentation. To edit the documentation, you must return to the template and change any fields or text areas that are necessary. You can also set this document at draft status from the Submit screen. It works in the same manner as Quick Save. There is also a Cancel button on the Submission screen. If you use Cancel, it will remove all documentation from the record and cancel the entire note. So use this button with caution, if at all. After you have submitted your note and are satisfied with the content, you would select the Signed button. This will open the electronic signature screen which you are used to seeing with orders. Applying a pin electronically signs and locks this note. The pin that you'll use matches the pin that you use for orders. Once a signature is applied to a note, it can no longer be edited. At that point, the note can only be modified using an addendum to the record. If you are a supervising provider for a mid-level provider or a crisis clinician, those notes will be submitted for cosign and will be visible in the sign queue. When you highlight a note, if you hit Submit, it will prompt you for your electronic PIN and will directly sign the note without modification. If you select the document and open the template, it allows the addition of cosign statements or additional findings to be added to the note. All notes are visible in Meditech, regardless of signed status. The note could be left in draft and partially completed, but still visible to other staff members. This helps with information sharing throughout the facility and allows other providers and caregivers to have access to the information to continue treatment of the patient.
Thank you for watching this tutorial. This concludes the initial overview. Other tutorials are available for review, as well as live training and on-site support after Live Day. Please contact Heidi with any questions and feedback at 860-496-6871.